In today's section, let's have a look at Modifier 22, 23, 24 and 25. When the work required to provide a service is substantially greater than typically required, in that situation Modifier 22 can be used. For that, documentation must support the additional work in terms of increased time, intensity, technical difficulty of procedure, severity of patient condition, physical and mental effort required, etc. We cannot use Modifier 22 with evaluation and management codes. The increment of work should be associated with a particular procedure, should not be described by another code. If another code covers the additional work, then we cannot use 22 again. Patients with morbid obesity, excessive intraoperative blood loss, any anatomical variants, etc. may require additional work to complete the procedure. In that situation, for proper coding, we can use Modifier 22. If the additional work is purely surgeon's choice for his easiness or something else, cannot use Modifier 22. It should be a necessity. Then we can use Modifier 22. Let's do an example. A patient has a colonoscopy and a polyp is removed. The removal of polyp causes excessive bleeding and extra time 30 minutes is spent to control the bleeding. This is very clear documentation about extra work. Extra 30 minutes is spent to control the excessive bleeding. The patient has excessive bleeding and the surgeon has performed extra 30-minute work. And the procedure is colonoscopy and polyp removal. This could be a clear case of Modifier 22. So, proper coding is 45385-22. Next is Modifier 23. It is the modifier of unusual anesthesia, a procedure which usually requires no anesthesia or local anesthesia because of unusual circumstances must be done under general anesthesia. In such cases, we can append Modifier 23. For example, cystoscopy usually do not require any general anesthesia, but if it is performed on a young child or the people who cannot be controlled, general anesthesia may be necessary. Append Modifier 23 in this case. Next is Modifier 24, which is used to indicate unrelated evaluation and management service by same physician or other qualified healthcare professional during postoperative period. During postoperative period, if any unrelated evaluation and management service is performed by the physician, by the same physician or other qualified healthcare professional, to indicate that particular situation, we are using Modifier 24. Let's see an example. A patient presents to surgeon office for a post-op visit following cholecystectomy. She is 35 days post-surgery. During this visit, patient expresses concern about a mole on her neck. The surgeon performed problem-focused history and expanded problem-focused physical examination. The medical decision making is of low complexity. Surgeon will perform a biopsy in 3 days. For E&M service, what code and what modifier we will append. This E&M service, this problem focused history, expanded problem focused examination, medical decision making is of low complexity, is performed in the postoperative period. For what? For mole on her neck. Is it related to cholecystectomy? Not at all. Not at all related to cholecystectomy, which is unrelated. To indicate that unrelated E&M service during the postoperative period, we will append Modifier 24. And the E&M code is 99213 and the modifier is 24. Modifier 25, which is used to indicate significant and separately identifiable evaluation and management service by same physician or other qualified healthcare professional on the same day of procedure or service. And this modifier is not used to report an E&M service resulted in a decision to perform surgery. It should be beyond the usual pre-op and post-op care associated with the procedure that was performed. To use Modifier 25 on the same day of surgery, there should be significant and separately identifiable E&M service. The E&M service may be prompted by the symptoms or condition for which the procedure or service provided. If that E&M service resulted in a decision to perform surgery, then we cannot use Modifier 25. For a particular procedure, usual pre-op and post-op care are there. But we can't use Modifier 25 to indicate that usual pre-op and post-op care, but there is a significant and separately identifiable E&M service, then we can use 25. Let's do an example for Modifier 25. A 4-year-old established patient present to his family practice physician office with 2.5 cm laceration to right anterior side of wrist. The laceration is closed by physician with two-way coil. During this visit, patient's mother asks the physician about her child's asthma. The physician decides to adjust patient's asthmatic medication and performs expanded problem-focused physical examination. In this, patient is presented to physician office with laceration, and for laceration closure is performed. During this visit itself, during the same day itself, patient's mother asks the physician about child's asthma. So, for that problem, for asthma, physician decides to adjust patient asthmatic medication. He is performing a separate E&M service for a separate problem. It is significantly identifiable. He is just adjusting the medication, so MDM is of low complexity. So it is an outpatient visit, established patient. For closure, superficial wound closure, simple repair 12001 we can code, and for that outpatient visit, established patient, MDM low complexity, we can code 99213 with 25 modifier, as it is separately identifiable E&M service. Let's compare Modifier 24 and 25. Modifier 24 is for unrelated evaluation and management service, whereas Modifier 25 is for related or unrelated. Related in the sense, certain procedure may be performed for conditions or signs and symptoms which is prompted by the original procedure performed. For such procedures or for such E&M services, we can use Modifier 25. Then Modifier 24 is performed after the day of original procedure, but Modifier 25 is on the same day of procedure. And we are using Modifier 24 during post-op period, but we cannot use outside post-op period. Whereas Modifier 25 we can use only on the same day of procedure. Let's wind up today's section. Please do like, comment, share and subscribe my channel Knowledge Mysteries. Thank you.